All right, Mr. Lally, whenever you're ready.
Thank you, Your Honor. Good morning, sir.
Good morning.
Could you please introduce yourself to the jury, spelling your last name for the court?
My name is Dr. Gary Fowler, F as in Frank, A-L-L-E-R.
And what is your occupation?
I am a physician pathologist.
And where do you work?
I work currently at Signature Healthcare in Brockton.
And how long have you worked at Signature, and in what capacity, sir?
Signature, I started it's probably 6 months. I took a new job 6 months ago. I am the Chief of Pathology and the Laboratory Medical Director at Signature.
And where did you work prior to your work at Signature about 6 months ago?
Prior to that, I was at Good Samaritan Medical Center in the same capacity.
And how long did you work at Good Samaritan for?
Since 2015, late 2015.
And did you work in any capacity similar to that prior to working at Good Samaritan?
Prior to Good Samaritan, I worked at the Kearney Hospital, which is in Dorchester. Started that job in 1996. So I stayed on staff at Kearney Hospital up until actually closed 6 months ago. So I've been on staff at Kearney's for quite a long time.
Where did you go to school, and what degrees did you receive?
I went to college at Tufts University in Medford, graduated in '87. From there, I went to Tufts Medical School and graduated in 1991.
And following your graduation, where did you go from there?
After medical school, I did a residency at Tufts Medical Center in 1991 to 1996.
And then where did you go following your residency?
And right from residency, my first job was at Kearney Hospital, which I previously mentioned, so 1996.
And doctor, are you board certified?
I am board certified in anatomic pathology and clinical pathology.
And what is a board certification?
Board certification is something we need to show that we are actually qualified to perform the job that we need to do, both in anatomic and clinical pathology. It's a written exam that we take and we need to pass. To demonstrate that we're competent and know what we're doing.
First, in just general terms, if you could explain to the jury, what is pathology?
Pathology is, there are two basic branches of pathology: anatomic pathology and clinical pathology. Anatomic pathology is basically an anatomic pathologist is a physician or MD or a DO trained to make diagnoses on patients via looking at tissue biopsies, organs, tissue fluids, and we're also trained in autopsy pathology as well. So basically, an anatomic pathologist, we look at tissues via glass slides. Slides are made, and we every day make the diagnosis of, somebody has a cancer or somebody doesn't have a cancer, benign. Look at colon polyps, breast biopsies, pretty much anything that comes out of the operating room or a physician's office, any sort of biopsy. Clinical pathology, on the other hand, is basically a clinical pathologist is a physician, an MD or a DO, who specializes in the clinical lab, which basically is any fluid specimen, including blood specimens. When you go to the hospital and you have your blood test and it gets sent to the lab, the clinical pathologist is ultimately responsible for the quality of your lab tests and quality, and basically that's it.
And so the time that you worked at Good Samaritan, did that cover the date of January 29th, 2022?
Yes.
And again, what was your title and what was your job at Good Samaritan in the month of January 2022?
I was the chief of pathology at the time and laboratory medical director.
What did you do as the laboratory medical director?
Laboratory medical director, basically, the laboratory medical director is responsible for the ultimate quality of any, either whether it's a biopsy, somebody's biopsy, or lab result. The laboratory medical director has to make sure that the final result is of excellent quality. So there are many different things that we need to make sure that things that are in place, as far as need to make sure we have the correct amount of workers. You want to have enough workers. You want to make sure they're competent. So as many, there are policies for competency for all the lab techs and phlebotomists and even pathologists. So basically, the laboratory medical director, if something goes wrong, it's ultimately his or her fault.
And the lab at Good Samaritan, is that lab accredited?
Yes, it is.
And by what body?
We are accredited, or Good Samaritan is accredited by the, we call it the CAP. It's a College of American Pathologists. They are considered the preeminent accrediting body for hospitals. They've been around for probably 70 plus years or so.
What is accreditation? What does that mean?
Accreditation is basically something that says that your laboratory is following guidelines and providing excellent quality. To be accredited with the CAP, every 2 years we have a laboratory inspection. They don't tell you when they're coming. They will give you a 3-month window, and they'll come and inspect you to make sure we have a good quality lab. Each section of the lab, pathology, the clinical lab, microbiology, chemistry, hematology, the CAP has a checklist with numerous requirements that one needs to fulfill. There are probably over 3,000 items that they look at.
And was your laboratory at Good Samaritan, was the accreditation up to date on January 29th, 2022?
We were accredited. Still are.
Now, in Good Samaritan Medical Center, when a blood test is ordered, what types of things is the lab testing for?
I think the most common tests that are performed when you go and you have your blood test is one is chemistry, a chemistry test where we sodium, potassium, chloride, glucose. We also a common test is a CBC, or a complete blood count, where we look at your red blood cells and your white blood cells and your platelets. Those are the two most common tests.
And why is blood testing ordered in the course of medical treatment at a hospital?
When you're admitted to the hospital, usually you're sick, so the physician is usually a standard, ordering chemistry and CBC to see if there are any clues in those tests that could help the doctor take care of you. If they look at a BUN and creatinine, maybe if they're elevated, you either could it be dehydrated or have renal failure. If you look at liver function tests, maybe there's something wrong with your liver. So it's just a general, a good look at the patients to see if there are any clues that could help them.
And as far as the blood testing results are concerned, how does that assist either a doctor or a clinician in treatment and diagnosis?
Basically, what I just said. If there's nothing, if the results are normal, that sometimes helps too. Rules things out. If they're normal, if they do a CBC and look at the hemoglobin and it's low and patient's anemic, maybe the patient might need a transfusion. So there are many different case scenarios where the results can help the provider, the clinician.
Now, with reference to alcohol, does the Good Samaritan Medical Center, do they also test alcohol within the blood?
Yes, we do.
And why would that assist medical treatment and diagnosis?
I think if a physician is wanting to know if somebody's been drinking or has alcohol on board, or maybe not, maybe that patient has ingested maybe drugs of abuse, so they'll test for alcohol to see, one, if it's positive, and if it is, then it helps confirm that the patient has been drinking.
Now, are there any policies and protocols at Good Samaritan Medical Center with reference to how blood is taken and how blood is tested?
Yes, we have numerous policies. We have one policy specifically for phlebotomists. Those are laboratory technicians who draw the blood. So we have a policy for them to explain exactly what they need to do. And also in the laboratory, we have numerous policies basically for any tests that we provide. And so we have a policy for alcohol testing as well.
May I approach the witness, Your Honor?
Yes.
Doctor, I'm placing before you two sets of documents. Just ask you to review those generally and look up when you're finished. And do you recognize what those are, sir?
Yes.
And can you explain to the jury what is contained within each of those two sets of documents?
Okay. The first one is a patient preparation for specimen collection. This is the policy that I was mentioning, specifically designed for our phlebotomist to detail the procedure of the blood draw. Basically goes through one of the most important parts of the process is correct patient identification, where we need to correctly identify the patient. We have the patient state his or her first and last name and state it out loud to make sure it matches the patient that we're trying to draw. And then we also match up the bracelet to the medical record number on the patient's bracelet. So one of the most important things is correct patient identification. The rest of this policy goes on and just pretty much details what to do next, including finding the veins, cleaning the site. It has some information on if there are any complications. So it's basically the entire process of the blood draw. The second one is our alcohol policy, which pretty much details in detail what goes on behind the scenes for an alcohol blood test in our hospital.
May I approach again, Your Honor?
Yes.
Now, doctor, what types of precautions are in place at Good Samaritan with respect specifically to alcohol testing in the blood? Or I should say taking the blood sample from the patient.
Yes, one of the major things we need to do with taking somebody's blood for alcohol is to obviously not use an alcohol swab. Normally, when you have your blood test, they cleanse the area with a swab that contains alcohol. So in our policy is a specific statement that says, do not use alcohol swab because potentially when you're drawing the blood, if you suck up some of that residual alcohol, you could cause a false positive. So we have in our policy, and every hospital should have the same policy, where we use a swab that has no alcohol. We call them a moist towelette. That's what we refer them to. Also, in the emergency room, my supervisor pretty much removed probably 95% of all the alcohol swabs. So just in case a phlebotomist forgets to not use an alcohol swab, they are hard to find. We need to keep a few there because we need to use alcohol wipes on certain tests like blood cultures and stuff like that. So,
when were the alcohol swabs removed from the emergency department?
It was before my time.
So fair to say prior to January 29th, 2022?
Correct.
What is a phlebotomist and what do they do?
So a phlebotomist is a healthcare professional who specializes in drawing blood. So they're the ones who are trained, competent, and know what to do when they draw a patient's blood.
What kind of training do phlebotomists receive at Good Samaritan?
We try to hire phlebotomists who have been trained. It's just easier. So they can have a high school background, but if we train on site, they just need to be trained on the proper protocol, proper procedures, and demonstrate competency.
Is there any sort of proficiency testing related to phlebotomists at Good Samaritan?
There's no proficiency testing for phlebotomists, but there's competency assessments. So with phlebotomists or any laboratory technician or even pathologists, there are strict guidelines for competency. We have to always make sure people know what they're doing, and it's a CLIA or a federal government regulation or requirement. So when anybody first starts in a hospital, the requirements are, one, initial training. You can't let anybody come in on their own, without not knowing what they're doing. So we have to document that they have the initial training and they're competent. And then the law says 6 months from that, we do another competency assessment where we look at 6 elements of competency defined by CLIA, and 6 months from that, 1 year from the start date, is another competency, and then after that, it's annual thereafter. And that goes for phlebotomists, and that goes for any laboratory technician.
Doctor, once the blood is drawn by the phlebotomist, what happens then?
So the phlebotomist will draw it at the time. They need to have the specimens labeled in the patient's room because you don't want the phlebotomist to mislabel. So everything gets labeled at the patient's bedside with an initialed and with the phlebotomist's initial and date and time. That blood test will then be sent to the lab. In this case, blood was drawn in the emergency room, so it gets packaged into a plastic bag and sent in a pneumatic tube up to the laboratory.
And once it's sent to the laboratory, what happens with the sample from there?
Once we receive it, it's called receiving the specimen. There will be a technician who then goes into the computer, enters the phlebotomist's name from the tube into the computer system, enters the time, and the technologist will look and see what was ordered, and then do the appropriate next step based on what was ordered.
And in a case in which alcohol is one of the items that are ordered, what is the next step as far as the testing goes?
So the next step with alcohol testing, we use a specific tube, so the phlebotomist would know what tube to use. It would be a light green tube that has lithium heparin in it. It's an anticoagulant. We don't want the blood to clot, so that's why we use an anticoagulant. So the first step when testing for alcohol is that the test is designed to be performed on serum or plasma. And to get that, the next step would be to centrifuge the blood. A centrifuge is a machine that spins the blood rapidly. We spin it at around 3,300 RPMs, which is pretty fast, rotations per minute. And the reason why we spin it, because centrifugation will allow it to separate the blood components based on the density. So heavier stuff like the red blood cells will go to the bottom, and the lighter stuff like the watery component of the blood will go to the top, and some of the white cells go into the middle. But for alcohol testing, we are targeting the top part of the blood component, which would be plasma.
And then once it goes through the centrifuge process, what happens then?
So once it's centrifuged, we have the separation of the blood components. We have the plasma ready to be tested, so that technologist will walk the specimen over. It's probably 10 feet from there, and put it onto our Roche Cobas machine. That's our machine that performs our chemistries as well as alcohol testing. It goes onto a machine. All the testing is basically inside of a black box, and the label present on the blood tube will dictate what the Roche machine will test. So based on the barcode label, once it's on our machine, it knows what test to do, and it will perform an alcohol test.
And Doctor, for our stenographer, do you know how to spell that Roche Cobas machine that you were just referencing?
So R-O-C-H-E, Roche, and Cobas, C-O-B-A-S.
Thank you, sir. May I approach, Ron?
Yes.
Do you recognize those records, sir?
Yes.
And what do you recognize those to be?
These are the medical records of Karen Reed.
And, sir, is there an indication within those records as far as the date of treatment for Ms. Reed?
Yes, there's a bunch of dates in here.
As far as the treatment is concerned, sir?
Yes.
And what is the date of treatment?
Oh. 1/9/22.
Sorry, is that 29/22?
That's what it says on this. Admit date, it says 1/29/22.
Thank you, sir. That's fine. Doctor, if I could direct your attention further into the document to a previously tabbed portion, do you see any indication in there as far as a result for alcohol testing?
Yes, I do.
And with respect to that result, have you reviewed these records prior to today?
Yes, I did.
And if you could explain to the jury sort of the timeline from this blood sample as far as, let's start with first when it was ordered.
So when it was ordered, it was 9:03 in the morning.
Okay. And when was it taken, sir?
The blood test was taken 5 minutes later, so 9:08.
And then what happened, or what is the next time that something of any significance happened with it?
5 minutes from that, 9:13, we received it, and 9:53 in the morning, the result was entered into the computer. So it was ordered at 9:03, and I believe it was 9:53. The results were in the computer.
And may I approach again, Your Honor?
Yes.
And Doctor, what was the result of the testing for alcohol in the defendant's blood when it was taken shortly after 9 a.m. on January 29th?
93 milligrams per deciliter.
Thanks.